CHÉOS exists to improve health outcomes for BC, Canada, and the world. Learn more at chaos.ubc.ca.
Well, good afternoon, everyone, and welcome to the Center for Health Evaluation and Outcome Sciences Work in Progress seminar. My name is Erin Sherbin. I'm the Chief Clinical Research Officer for the Center, and I'm really excited to introduce our guest speaker today, who's coming to us online, not in the room. So our guest speaker today is Dr. Jag Gill, who is an Associate Professor of Medicine in the Division of Nephrology at the University of British Columbia and Medical Director of the Kidney Transplant Program at St. Paul's Hospital here in Vancouver. He also serves as the President of the Canadian Organ Replacement Register Board of Directors and the Vice President of the Board of the Canadian Society of Transplantation. He is a research scientist at CHÉOS and the recipient of a Canadian Society of Transplantation Research Excellence Awards. He conducts epidemiological, health outcomes, and health policy research relating to living and deceased kidney donation, cardiovascular disease in transplant recipients, and inequities in donation and access to transplantation. The title of the presentation we're watching today is Co-Creating Digital Stories, Advancing Equitable Access to Living Donor Kidney Transplantation, or LDKT for short, through culturally relevant education. So without further ado, I'd like to introduce Dr. Gill.
Thank you very much for the introduction, and my sincere apologies for not being there in person. That certainly was the intent, but as you gather from my voice, I've got a bit of a tickle here, and I thought it was the responsible thing to not be in the room with all of you today. So it's a pleasure to be able to go through some of the work we've been doing here, and I'd like to start by first acknowledging where I am and where I am fortunate to work and to play and to live in the ancestral and ceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm in the North Shore right now, so I'm in the Squamish Nation region right now mostly, and a lot of the work that I'll be alluding to in this in terms of our work to advancing equity and access to transplantation actually really has been born out of learning from Indigenous cultures and the Indigenous peoples in our province. I have no financial disclosures. So what I thought I'd go through during this period that we've got here, and hopefully have some time for discussion at the end, is to outline a bit of an overview of what we're trying to do in terms of how do we achieve equitable access to transplantation. And in the context of that, talk about the role of digital storytelling, how that's evolved in our work, and then some of the initiatives we're in the process of and have already undertaken in BC. So just for some context, this is the number of kidney transplants in Canada. This is looking at a 10-year period from 2012 to 2021. As you can see, there's about 12, it used to be about just over 1,300, and jumped up to the average for most of this decade. It was about 16 to 1,700 kidney transplants per year. And then in 2020, it dropped due to the pandemic, and it has actually rebounded again in 2021. This is looking at living donors. So the total numbers I was showing you were, on the 1,600 range. This is the number of living donor kidney transplants. So this is when a friend or a relative or a loved one donates one of their kidneys while they're alive. And this accounts for a sizable proportion of the transplants we perform in Canada. So roughly about 500 a year are done across Canada. A large proportion of those, about a fifth of those, are done in British Columbia, probably closer to a quarter, in fact. And so we have been fortunate that we've had a very high rate of living donation in our province, and it's been the highest in the country for many years now. Now, if we take a step back and say, let's look at kidney disease and who we've got here in terms of who's developing kidney disease more likely. Kidney disease doesn't really spare anybody, unfortunately. It's seen amongst a large swath of the population. But when we look at certain populations, we do see a higher prevalence of end-stage kidney failure. And so often there are people that are in marginalized communities, so people in racialized communities, those with lower socioeconomic status. And in Canada here, Indigenous communities certainly have higher rates of kidney disease. In terms of access to transplant, which is for the vast majority of patients the best available treatment for patients when they're approaching kidney failure, there are significant inequities in access to transplant. And these are, you can look by the references here how long this issue has been described. And so this is old data, and then there's a newer data that basically shows the same thing. And so if you look relative to white Americans, if you look at Asian, Hispanic, Black, Pacific Islander, you're seeing consistently lower access to both deceased donor transplant on the left, and then on the right, the effect is in fact exaggerated for living donor transplantation. And of those two treatments, when we have a patient, the one we really want a patient to go for is a living donor transplant because it's more timely and it results in the best outcomes. And so the greatest disparities, unfortunately, are in fact in living donor transplants. And as you can see, that's persisted even in more recent studies. In Canada, again, this is an old study that's described this. We see this in different kind of racial groups. East Asians were found to be 29% less likely to undergo kidney transplants. Those in the South Asian community, about 31%. And the same pattern, when you look at living donor transplant in particular, those disparities really get magnified. So 73% less likely to get a living donor transplant if you're East Asian ethnicity, and 58% if you're Indo-Asian ethnicity, less likely to undergo a living donor transplant. Similarly, if we look at Indigenous communities, access to transplant has been poor relative to other groups. This is very crude data, but it's kind of what we have, which basically just looks at the proportion of patients. This is national data, the proportion of patients that have kidney failure that are either on transplant or some form of dialysis, transplant being in the green here. And as you can see, for non-Indigenous versus Indigenous groups, there's a big difference. And so we're seeing a smaller proportion. So if we kind of dig deeper and say, well, what are some of the challenges or what are some of the realities for Indigenous populations? We know there's a higher incidence of kidney failure. We know that survival on dialysis is not great. And that's not restricted to Indigenous communities. That's the general fact. There's a sizable portion of people that live in remote areas in our province. But then you look at the transplant, they're 50% less likely to get transplanted, and 20% of individuals live more than 250 kilometers away from their closest kidney care center. So some very significant cultural and geographical barriers there. And so the bottom line is, I won't belabor the point, there's inequities in access, and everybody needs improved access. By definition, the fact that we have wait lists for transplantation means that there's inequity and that there's an access problem, and that most people who need a transplant aren't getting it right away. There's a wait time. So everybody needs improved access, but it's most urgent for those that are disproportionately disadvantaged here. And so in the way we've kind of gone about this is kind of look at, if we've been fortunate enough to get some funding to look at a few key populations in which this is impacting access quite significantly. And the intent with these studies was to kind of move beyond the descriptions, which have been in the literature for decades. It's been just describe the disparities, and we really wanted to have tangible steps to move forward. And so the Bridge to Transplant Initiative is a CIHR SPOR-funded initiative that's in which we are developing and implementing a provincial support system and a change to our clinical pathways to improve access for Indigenous patients from Indigenous communities around the province, to improve access to transplantation. The Action Project is a similar study focused on the South Asian community that was funded by Health Canada through an initiative called the Organ Donation and Transplant Collaborative. And it was identified as a priority area to kind of address it. And so these are the two studies from which I wanted to review some of the data that we've got that's led us to some of the storytelling piece that we'll discuss today. So again, for some perspective, this is what the pathway looks like. And this is probably a simplification of it. So essentially, if someone is a potential candidate for a kidney transplant, they have to go through these steps themselves. They have to get referred, they have to be evaluated, they have to either be approved if they are eligible, and then activated. And then they basically have to wait till they get a transplant. In addition to that, patients who are approaching kidney failure, or patients who already have kidney failure, if they're deemed to be a transplant candidate, we're also trying to educate them about living donor transplantation. So understand what that involves and educate and encourage people to go out and try to identify potential donors. And so people will go out, do a fan out, will ask friends, ask family, and if there's an individual or individuals that are interested, those people now have to, on their own merit, come up and go through their evaluation process, which is about a 10 to 12 month process, depending on where they live, how quickly they start it, how long the process takes, how complex their medical care is. And then both of these really have to happen before you can facilitate a living donor transplant, including matching and all that stuff. So it's not a simple process, and it takes a lot of work on the part of the patient and their families. So the goals of Bridge then were to kind of, obviously overarching issue was we wanted to improve access to living donor transplantation, in particular for Indigenous patients. But we wanted to do it by changing the current way we deliver care. So it's coming at it from an acknowledgement that there's something that's not working in the current system. And in order to do that, it was really important to anchor that work in engagement. So to engage with patients and community members so that we can better delineate the specific barriers that need to be addressed, and then develop interventions in partnership with them. These are our patient partners that have been our primary patient partners, Elise Asu and Adrian Charlie. They're a donor recipient pair that have been absolutely instrumental from the very get-go. Some of these individuals have moved on. That's how long we've been working on this, but these are the administrative policymakers that we began the project with, and the clinicians and the implementation team. For the interest of time, I won't name everybody, but I'll acknowledge them again. The first phase of this work was what we call the development phase, which was kind of getting those, the grunt work part of it. So focus groups and interviews were conducted with patients, with living donors, with Indigenous elders from around the province. And then we tried to address certain questions and barriers to say, how do we move forward here? And we also had to engage with key organizations that are involved in both delivery of kidney care, transplant care, as well as Indigenous health. The bottom line, in terms of what we came across, there were some major themes that we found. So first, these are the barriers that were noted, and some of these are intuitive, right? There's a clear discomfort in approaching those in their community about living donation, and that's very common. Most people are not keen on the idea of going out there and asking for a kidney, but that issue was clearly there. But importantly, the willingness to donate was not felt to be a major barrier by elders, by community members, by patients. The issue, there is quite a culture of giving, and therefore the piece is not finding someone who do it, it's just the ask that was the major issue. And then the other major piece that came up was education and trust. And so the education on the benefits of living donor transplantation was felt to be really critical, that we modify what we currently have and we do a better job at kind of highlighting the benefits of transplant. And that might in fact increase willingness to pursue. It was important that that information come not just from medical professionals, but also from trusted individuals such as elders, and that the community be engaged and community members be engaged as an ongoing piece, not as a one point, we're coming in, getting information, and then we're going to change. There has to be a longitudinal relationship there. In terms of specific health services pieces that were perceived to be barriers, we currently do educational sessions in hospitals, like we'll do group education sessions. Those were not felt to be culturally safe for various reasons, given the complex history with healthcare institutions and Indigenous peoples. Also, there were specific examples that lend helpful educational interactions with healthcare staff that weren't the most culturally safe. Our go-to, as in many programs that we have in our hospitals, our written material is kind of the primary source in which we deliver that information. That was flat out felt not to be very helpful. Many patients said they don't even read that stuff. It just kind of sits on a shelf. And so that was an important finding. And then in communication with community members and elders in particular, the context that verbal communication is really the preferred mode through which people would like to obtain information in the Indigenous communities. And then, of course, as I alluded to earlier, one of the other major health services barriers is that there's not that much representation, and then therefore there's a lack of longitudinal relationship with Indigenous communities, and that travel for those that are living in rural and remote regions is quite significant. So I want to focus in on the storytelling piece and the education piece, because that's what we're going to talk about today. But really, the importance of storytelling was highlighted by a number of individuals who we interviewed. Storytelling was felt to be the preferred way of knowing about living donor transplant. We were told that storytellers can serve as living examples and provide that experiential expertise that we often can't. It also avoids information overload and is an opportunity to listen to someone's story as opposed to just being given a slew of facts. And it can help to improve the understanding of the process from an experiential perspective. So again, round out what we're doing, people. Now, they can also be shared through multiple medium formats. So in person is obviously preferred, but understandably, online and video is something that has been utilized in many ways to help share stories. It was important to have representation among storytellers. So you must, a participant said, to have an Indigenous person doing the speaking and the narrating would be highly beneficial and would resonate much more. Trust was thought to improve when you're hearing stories from people that are known, or the information is shared through trusted sources such as Indigenous elders or band offices. And then storytelling can also be taken outside of the patient realm and in the broader sense in the community, and may address information gaps on a more generic way. And then ultimately, though, we also have to consider the accessibility of it. And so understanding this is a provincial program we offer, there's people living in areas where maybe internet connectivity is not good. We must come up with mechanisms to deliver these stories in multiple formats. Now I'm going to shift gears a little bit to kind of talk about the alignments with the Action Project, which is a similar initiative to understand disparities and a very similar approach we took modeled after the Bridge study, but it was looking at two communities. In BC, we looked at the South Asian community, and we partnered with our colleagues in Ontario at University Health Network at U of T, and in which they were looking at the experience in the African, Caribbean, and Black communities. And again, it was much the same aims as I outlined before. We want to identify the barriers, co-develop some solutions that are very tangible from a health services and policy point of view. So this was just to give some context as to why we went with the South Asian community for this study. This is the ethnic diversity in BC. We know that there's a large East and South Asian population. We had already developed links with the South Asian community in the past through work we had done. So when this opportunity came up, it was a good opportunity to leverage those things to try to get some work done here. But clearly there's work that needs to be done in other communities also. These are our patients and donors that, again, this was a patient partnered kind of initiative with community partners. And I'd like to specifically call out Raj Hundal, who's from Progressive Intercultural Community Services and has been kind of a key partner in kind of helping us facilitate some of this work. So again, we did in-depth interviews, we did focus groups, and we did a series of community engagement activities to get some information. And again, asked about the process, what the barriers were, and how we can move things forward. Importantly, the way we presented the focus groups was in different languages. We stratified men and women so that we could explore some gender-specific issues. We talked about transplant options. We used case vignettes for general community members so they could understand what the context was. And we tried to get some information here. So what were the barriers to finding a donor? So there were some positives and negatives. So in the South Asian community, there is a strong kind of familial ties often and a strong family network. And that was seen as a positive as identifying donors. However, there was a reluctance to go outside that unit. And so much of the donor outreach is really limited to family and close social circles. There was a lot of stigma, guilt, and shame, especially accepting a kidney from someone who was younger. And again, there was a lack of understanding about the safety or benefits. And so there were people that were just not interested in exploring this because they didn't have the information to really get them up to speed on this. Interestingly, there were some gender and age-related cultural contracts that was important as well. And so, for example, someone says, as I said here, I think it would be harder for a female to find a donor. They wouldn't be expected to do that, and there would be familial challenges with there. And so a theme that came out that quite strongly was that there were definitely more limited opportunities for women and the elderly, and especially elderly women, due to a bit of a perception that perhaps it was just more challenging to navigate the family dynamics to actually put out the ask, and then even if donors come forward, there's some challenges in terms of understanding when to accept and when not. Now, in terms of health system factors, we kind of, what worked, right? So the close-knit family structure is an advantage. There's a way to kind of mobilize the family unit to help find donors and to help facilitate and navigate patients through the healthcare system. The trust in the healthcare system and the folks we talked to was quite high. Some of that was a factor, the fact that in British Columbia, there's quite a strong South Asian representation in the healthcare system. And so that came up a few times. There's members in the transplant team that are South Asian. That came up, that made people feel a little more safe in the process and a little more trusting of the system. But there were also significant things that need to be fixed. And again, at the top of the list was the need for validated, reliable information on the safety of donation and the benefits of living donor transplantation. And interestingly, radio, general media, using those things were highlighted as important tools, and making sure that we're representative of people who speak different languages was important. It was recommended that we should be leveraging the shared culture and representation that exists already in the healthcare system and build on that. And recognize the fact that decision-making may be a little different in larger family units in the South Asian community, where collective decision-making can actually be quite impactful and helpful, but at the same time, you need to be aware of the gender dynamics, as sometimes those familial issues can disadvantage some members, such as women in certain circumstances. The other thing that we saw that was relevant to kind of storytelling and that piece of it was that if we actually, there's an openness for people to share a story and listen to others' experience. Many people volunteered and said, I'd love to share my stories. There was a needed for South Asian representation among storytellers and kind of wanting to see diverse stories, both linguistically as well as religious and culturally. Stories similar to the themes we saw with the Indigenous community, thought, well, they should be told in spaces that are important to community. So not just someone sitting in a hospital, but religious spaces, community spaces must be represented. And of course, we need to recognize that the South Asian community is not a homogenous community. There's different languages, there's different cultures within that, and that needs to be acknowledged as we move forward with this. Many of the same themes, again, as to how they would be helpful in terms of understanding the process, learning from personal experiences, and in fact, with helping with informed decision-making. And it was thought, interestingly, as being a tool that could really work to enhance community engagement efforts. And so if donors and recipients can become community ambassadors, that can really help to spread the word and increase awareness about these issues. So one interesting piece that came out that was relevant in the South Asian community is the role of radio. So the radio is a significant medium in the South Asian community, more so than we would see in the general community, where other forms of media seem to are typically seen as more impactful, whether it's social media, whether it's television, whether it's whatever. But radio really seems to be a strong piece in the South Asian community. And you can see by, a lot of South Asian, these are quotes from different patients on this. So one patient said that we like the radio stations that we have, they're quite popular around the community. A lot of our South Asian community here, there's the common radio stations that we all listen to. Radio could be used as a way to send out information and as a way to talk about my story and ask for help in finding a living donor and sharing our experiences. So radio is there's a number of radio shows, and we've started to leverage this already by doing different interviews and sessions, and we're continuing to partner with them to develop a more robust kind of longitudinal awareness campaign by using that. This is an example of how impactful it can be. So this is a story. Montage Dillon is an individual who actually donated his kidney after hearing about it through radio. So someone went on the radio and a South Asian radio station said they needed a kidney. Montage heard this and said, well, I'll do it, and went forward, and lo and behold, was able to be healthy enough and was a match, and therefore ended up donating. This is the headline was the Lost Brothers found through a radio show. So it just goes to show you how impactful this medium potentially is, not just in a general education sense, but even in terms of facilitating individual patients finding donors. So let's talk about storytelling a little bit then. So obviously storytelling is not a new phenomenon. This is not something that we haven't been aware of, that storytelling is important. But if you take a step back and think about it, obviously we know that storytelling is integral to our history, is integral to our present, whether it's through art, whether it's through books, whether it's through, digital mediums now. Storytelling has always been a way to connect human beings through stories. And that's something that we can and should probably leverage a little more in the healthcare setting. The other advantage of storytelling in the current era is that, stories interestingly cut across cultures. And so while we're trying to make our systems more culturally safe and more culturally tailored and sensitive, it's important to understand culture-specific barriers, and resources that are required, but also acknowledge that, that when a person from one culture, their story is not only relevant to people from that culture, even if it's got cultural nuances to it, that's relevant to many cultures and to all of us. And that's kind of the beauty of diversity, is that we all learn from one another. And so, this picture was just to highlight, if any one of us go on one of our, whether it's Netflix or whatever, there's all kinds of global cinema that we're all sharing, we're watching, we're resonating with the stories. And that's really been an example, and I think, of how stories can connect us. And I think, again, we can leverage that pretty strongly here in our setting. If we kind of take a step back and say, what's the role of storytelling in terms of Indigenous ways of knowing? There's obviously a very long history. And I said that off the get-go in this presentation during my land acknowledgement, that this whole idea of storytelling is really anchored in Indigenous ways of knowing. And the Indigenous approach really to knowledge considers multiple issues. It considers the metaphysical, the holistic, the symbolic, the relational, it's intergenerational. Storytelling has been critical to maintaining and reclaiming history and culture for Indigenous peoples. And it's taken many forms over the time, and really, whether it's oral storytelling, whether it's drumming, whether it's pictographs, elders have a key role in this. And it has been applied in research, in education, and in clinical practice. And so, again, going back to what I just said a few minutes ago, applying this lens is not only beneficial for Indigenous people, this is a model that we can be using in terms of how we deliver education and information across the board. Similarly, just to highlight the similarities, in the South Asian culture, storytelling is also relevant, highly relevant. So cinema, theater, arts, religion, folk tales. It's been a huge way of the South Asian community in Canada, and also within India and other countries in the Southern Asia region there. And so, there's many movies that have, again, resonated and collectively, and that it's a big part of the culture. And so, again, another opportunity that we can leverage here. So how has storytelling been used in healthcare to date? Well, it's been used to kind of foster this idea of having things make sense, right? So what they call sense making and sense giving. So patients who are managing difficult chronic conditions, who are people who are going to have to navigate many aspects of a complex healthcare system, hearing other people's perspectives who've been through it is really critical. It's also been used in terms of supporting the exchange of learning as well as knowledge translation. It's obviously been used in education of healthcare providers as well as patients and families. And often, and that's really been most of the use, in that it's been, an engaging way to communicate and help patients and their families make sense of that journey that they're going on. And, again, there's professional development and learning for healthcare providers as well, using stories to help, more and more in our conferences, we're hearing patient stories to help us resonate with what we need to do as clinicians. Importantly, storytelling helps expand empathy and compassion, and it promotes those feelings. It also facilitates, as I said earlier, cultural exchange. So it's a real life example of kind of understanding cultures a little better. This was a study that's shown the actual hard outcomes that you can get from something like storytelling. And so this was a randomized trial of African-American patients who had hypertension. And it was very simple. They had a series of 3 DVDs of patient stories, which was around what is hypertension, how you got to monitor it, what are the challenges, really pretty basic stuff, but it was told from an experiential standpoint by patients. And patients were received these at baseline, 3 months, and 6 months, as kind of to make sure they were on top of their blood pressures. They highlighted behavioral changes, increased awareness. And in fact, those who received the storytelling actually had improvement in their blood pressure readings at the end of the study period, suggesting that this is a pretty effective way to translate knowledge that will impact patient behavior and potentially outcomes. So let's bring this back now to donation and transplantation. And so how do we use storytelling in this context? And I think there's a number of useful pieces. So I showed you that slide earlier that shows how convoluted and how involved that process is for a patient who's trying to get to a transplant. And add to that the fact that, you know, the only provincial transplant programs are in Vancouver. Patients now need to be referred here and go through that whole additional piece there. And so there's a lot of pieces we need. So one of the key pieces is peer support. It can certainly be a source of peer support. So patients can get a sense of that they're not the only ones going through this. And that can also lead to one-on-one peer support as needed. It's obviously functional, it's useful, it can be effective at kind of making recommendations for patients in terms of what they need to do in terms of their healthcare. And it can also provide, you know, that experience to patients so that they have easy access to stories that are going to help them work through it. A good example of this has been led by Amy Waterman. Amy Waterman's a PhD who's been doing a lot of work in this area in terms of improving access to transplant and really focused on living donation. And so she developed this program called Explore Transplant, which began with very much an idea of kind of getting healthcare workers. The first iterations of this was healthcare workers making videos and providing those stories to patients. And there were some improvements that are with that. And this current phase of it now is leveraging the patient story piece. And so it's a website that's meant for kidney patients, potential donors, and healthcare providers. And now it includes educational videos, which is the animated piece, the healthcare piece, but also patient stories. And so they have a web-based library of living donation narratives that use video capture technology. So the patient can record the video themselves, they can send it back pretty easily. And as a result, they've been able to amass a large number of stories. And this has been expanded into Canada now too, through Canadian Blood Services, where they're trying to track some of these stories. And really, they looked at the outcomes with this. And so there were about 137 patients that were, or stories, I should say, that were included from transplant recipients, living donors, family members, and patients who were looking for a transplant still and hadn't yet achieved that. And they recorded their personal stories. They used video capture technology. They get these prompts and they answer the stories on their phone or their computer. And then that gets booted back into the system, and then they generate a video based on that. And they actually went back and asked patients questions about their experience, or storytellers, I should say, about their experience, and tried to get a sense of what some of the benefits were. So the major motivation for people to do this was to educate. They wanted to spread awareness, they wanted to help other people become donors, and they wanted to dispel some of the myths that they faced when they were navigating this process. Common themes among recipients is that their difficulties in kind of dealing with the uncertainties about donation or transplant outcomes were difficult for them, and they wanted to kind of do that. They wanted to discuss their faith, which often doesn't come up in our typical interactions. They want to talk about the support they receive, not only from their care team, but also from those around them. And they wanted to share the sources and the information that helped them. And so it was very much kind of an educating, helping guide people through it. Donors wanted to talk about watching their recipients return to improved health and what that meant to them, what motivated them to donate in the first place, but also talk about some of the fears and some of the anxieties that they had to go through during their workup and during the donation process. When they looked at the demographics of people who were participating in this, a high proportion of these people were white, it's about just under 70%, and a high proportion were female, about 65%. A large proportion were also educated with either college or vocational level education. And so not necessarily the most representative population of the kidney failure population. And so that's one of the major challenges that have come up. One of them is the lack of diversity among storytellers. So this is, again, a This is a put out there, let people respond and do it. And so it's been difficult to recruit what they call minority storytellers, and men in particular. And that's a major gap that needs to be addressed. And then the fact that there wasn't a lot of in-depth engagement with the storytellers may lead to some limitations, particularly in racialized communities or in Indigenous communities where you want to get more stories. As again, you're leveraging trust, and if the trust isn't quite, if that's not being built, it might be hard to get people to buy in. And then, of course, there's some technical challenges in doing this. Older storytellers had more difficulty navigating that than younger storytellers. And half of the storytellers that were offered a link actually didn't submit a completed video. So there was a lot of dropout in this. So some significant benefits here, but definitely some challenges that need to be addressed. Locally, there's a few different storytelling initiatives that have had BC Transplant and has got some digital stories that have been developed over time. They also did a campaign recently called Great Actions Leave a Mark. And they've come up with a series of little snippets and stories of, again, people sharing their transplant and their donation experiences. These are other stories as well, in partnership with the Kidney Foundation, where more stories have come up in a more diverse way. And so that's starting to improve in terms of seeing increased diversity. Now, when we did a bit of an environmental scan of what was out there and kind of thought, well, what's missing? And a lot of what was missing is still what was highlighted in that Waterman study that I highlighted a few slides ago. The idea that although there's an improvement in showcasing diversity, it's still really lacking. And there's not a lot of in-depth kind of ongoing longitudinal supports that are there in place. And so this, as part of the Bridge study, what we're doing in the action study, we're developing a new consolidated website on kidney transplantation. And we basically have consolidated all the existing education material we've had. We've vetted those with our patient partners and kind of crafted what works, what doesn't work, and reframed and then generated new material on that. And based on the findings we had through our studies, we have now developed kind of a whole new website with a whole new mechanism of providing education. And it's anchored very much around storytelling and Indigenous ways of knowing. And it's targeting, importantly, the general population, but applying a very diverse lens and an Indigenous ways of knowing kind of principle behind it. And so that's kind of where we are right now in terms of this. Now, in terms of the website and the way it would work, just to give you a sense of this, we will have detail, it's being developed right now. We're working with an Indigenous web design company named Inequities. We're working with Indigenous and South Asian filmmakers to talk to patients and to get those stories, so that this is, again, a more collaborative effort. And we're including stories not just from donors and recipients, but also from cultural leaders and Indigenous elders. And there's been lots of in-depth engagement with storytellers. These are people we've worked with, people whose stories we know in and out, and working with them to kind of craft the story they want. And we've gone to, so we just did a filming piece. We went to Vancouver Island and we did some of the Lower Mainland. And the plan is to show geographical diversity so that we have people from around the province, but also we're showing the regions people are coming from. And the way we're basing this is the fact that the storytelling is going to be the key component here. So we'll have longitudinal stories where people have kind of told their piece of it, but then also as people are navigating the website through their process, they're kind of picking off, right away, there's a story that aligns with. So someone says, what's it like after a surgery? We'll describe it. And then there's a story that kind of is an amalgamation of different patient experiences combined with some healthcare practitioner information that's relevant, but really that's minimal. It's heavier on the patient experiential piece. So patients will get that experience that they want to hear about what exactly to expect. And it's presented in a diverse way. It will be translated in multiple languages. There'll be subtitles so that the stories can be appreciated by everyone. Yeah, so we're very excited about kind of initiating this on. This is the first kind of set of filming. These are the individuals that we've been working with currently. This is Lisa, who's our patient partner. Scranchi Stewart, we've got Indigenous elders, we've got our teams here working to put this together. So we had a couple of days of filming, and now we're in the editing phase and moving through that and crafting those stories. Now, one of the major pieces we're doing here, obviously, is we're using the stories to help people understand the process, as I said. So this process will be supplemented, as I told you, in terms of what those stories are. And so that'll be a very novel component of this, as opposed to the existing websites, which simply have stories around what people's experience in a more generic sense has been. So to summarize the storytelling piece of it, it's clearly a powerful tool that we think is generally underutilized in healthcare. And although there's been evidence that it works and there's been evidence that it does, it's been limited really by the fact that it does take a lot of engagement, and it takes a lot of kind of slow burn kind of work to get through it so that you do it right. But I think these initiatives are critical, and they might help improve understanding, empathy, help the patient experience, and ultimately, I believe it will help patient outcomes. Now, importantly, I do want to say where this fits in the clinical pathway, right? So, there were a lot of findings with these studies we've been done. One key component has been digital stories, but those stories are going to be embedded amongst a larger intervention. And so this is being implemented currently as part of the Bridge to Transplant Initiative. So there's multiple components to the intervention. There's culturally tailored educational supports, which is what we've been talking about through the website and through developing these stories. But there's also Indigenous patient navigators that we're bringing on at St. Paul's and VGH to help navigate patients through their transplant journey right from the point of referral onward. There's also going to be tailored post-donation follow-up for Indigenous patients, because there is evidence that there's potentially a higher risk of metabolic disease, and therefore an increased surveillance plan that's more tailored is needed, particularly in people in remote communities where access to care may not be ideal. And then, of course, there's ongoing community components, so cultural safety awareness within our teams, which exists to a certain extent, but we're expanding that and have initiatives towards that. And also the ongoing engagement has been key. So we've got a steering committee that's ongoing. We're engaging any new initiatives, whether it's policy. As an example, we're currently vetting policy that would impact referral practices and allocation to enhance access to transplant for Indigenous peoples. And the first step is to engage with communities to see if that's something that would be palatable. Similarly, with the action study, which was focused on the South Asian community, there's also, this is storytelling's one component. And so culturally tailored education supports is one of the key patient level interventions, but we're also implementing mechanisms to provide enhanced language services, which is an important barrier for members of the South Asian community, and not just the South Asian community, but anyone in a non-English speaking group. And so that's being expanded, not just to the South Asian community, but just across the board. And then we've created cultural toolkits for teams to help provide some context in terms of cultural sensitivity. And a lot of the findings we can from this study really, though, were based on the community level. And on the community level, really what we're doing is a significant engagement effort to continue the work. And so we've put together a group, a South Asian group called SA ACT, which is basically a committee, a think tank of members of the community of healthcare workers around the province and community leaders who are involved in healthcare in some fashion, and of course patients and other community partners. And the goal of that is to kind of work together to provide sustained community awareness and develop a formal strategy. As an example, we're partnering with the Kidney Foundation. We're doing a gala coming up in the fall on increasing awareness, and also but developing community-directed and health policy. So as I mentioned with the Indigenous patients earlier, in terms of we're thinking about new policy in terms of allocation, similar types of initiatives could be foreseen here, but should be vetted and should come from community members and patients. And then similarly, for research priorities is also an area that we're getting information on from this so that we can kind of move this work forward as we try to work in partnership. And lastly, I'll just want to acknowledge the people that have really made this happen. These are our patient partners, and this is Elisa and Adrian, as I mentioned earlier. Our funders, the organizations out here, our partner organizations, and then our research and clinical teams. And then similarly for the action plan, our patient partners first and foremost, our research team here, as well as our partner organizations in Ontario. So I will end there and leave some time for questions. Thanks very much.